Jel?
Doc, si Dr.
Yes,
Rasonia po yung mismo yung nagpe-present.
Okay, sorry. Hindi ko siya naririnig.
Nakamute pa po.
Okay.
Let's go now to the preparation of an adequate and appropriate informed consent process and the form. Okay. So, J.S. Mill said that the only purpose for which power can be exercised over any other member of the community against his will is to prevent harm to others. If it's only for his own good, it is not enough to warrant going against the will of the other person. But over himself, he has his prerogative and sovereign right. Okay? So, getting the agreement of another person that a procedure or anything can be done to him will need a free and informed consent, both a process and a form that will show respect for the person and recognize the independence and autonomy of the person to decide what is the best thing that will be done to him or her. And it is the right of the person to decide and for his choice to be honored. Okay, if you're the participant here with a very complicated diagram, usually either you say no or even without understanding, you tend to say yes. And that is not a valid consent. So therefore, our goal for the session is to show you how to do an informed consent process and form that will be valid in your research. Okay, so we'll look at the meaning, importance, components, scope, the specific steps, and what to do in cases of vulnerable population like children, and then we'll summarize. Okay, so what's a free and informed consent? It's a permission given by one person to another so that that other person will act on him or her. And it's a continuous process, and it's not a one-time, big time, now or never or forever permission that is given. When conditions change, a reconsent is necessary, especially if it will affect the choice whether to continue participating or not. It's a legal and an ethical right, and whatever form is signed becomes a moral as well as a social legal document. Okay. Okay. What is it not? It's not an informed consent if it's a self-administered document without any explanation coming from the researcher. So that you will rely only on the understanding, limited or comprehensive, depending on the education of the participant. It's not just a signature that will say, okay, I agree to whatever you want to do with me. And a free and informed consent is not the only basis to make the research ethically acceptable. You have to look also at the scientific soundness and social value of the proposal. It's not a one-size-fits-all, that you have a template and this will be applicable to all types of participants and to all populations. So specific needs will need modifications or revisions of a template, and the content should be comprehensive and understandable. Okay? So what's the importance of informed consent? It will show respect for the person, that you acknowledge the autonomy or the independence of the person or the participant to make his own choice, and that he will exercise his right to say no or to voluntarily participate. Okay? It's a means for the researcher also to show that he or she appreciates the participant's potential contribution, because without a participant and without informed consent from the participant, there will be no research outcome. And for those who are with diminished competence or ability to decide, special protection must be in place. And this is a chance for the researcher to find out how ethical he is as a researcher, if he fulfills the requirements of a free and informed consent process and form. Okay, and therefore, we also look, the Research Ethics Committee also looks at the informed consent form besides looking at the process. And there are requirements that we look for before we approve the implementation of a research protocol. And this is the improving the informed consent process and form will be one way to improve the quality of the research. Okay, so we look at the components of the informed consent. First, the one who will give the consent should be competent, meaning has the capability to think through whatever contents there are in the form, and can, in his right mind, decide whether to join or not. There should be adequate and appropriate information, understandable at the level of the participant's education, and there should be the freedom to choose and the voluntariness to join. And of course, it should be documented, preferably, that he indeed will join. Okay, so in competence, the information appropriate and relevant should be complete, understood, and the participant, potential participant, should be given the option to take it home and talk about it with significant other, with the family members, or with the community if he likes. And he should retain a copy of the form that he will sign. And it should be done without any pressure, whether from the community leader, the husband, or the spouse, or the superior, and that the one making the choice should be in a stable emotional state, meaning he can understand fully the consequences of joining, and it's specific to the task required of the participation. Okay, about the information should be correct, complete, and relevant. There should be no overload of information. Sometimes in some clinical trials, you have about 5-10 pages of the informed consent. So if you're the one participating, you get dizzy and confused before you get into the middle of the informed consent form. So that this should be as simple as possible, but the pertinent data should be in there. And the different parts should be included, like why is it going to be done? What's the procedure? Why are they choosing that specific group of people or population? How many are involved? Because if only 2 of you are involved, you will think twice before joining any experiment or any study. But if there are many, then you will be more or less assured that there will be other people who will be willing to join, and probably the information that will be gathered will be useful and will be more applicable to more people. And of course, as we mentioned, the risks and the benefits. What are his rights? That he has the right to withdraw, to refuse anytime. That his data will be kept private and confidential, that he will not be identified at any point in the study, even after the study, during publication. And then what are the other things that he can choose from, the alternatives? So you should give the alternatives that he can choose from. And if he chooses the alternatives, it should be stated that there should be no penalty or any punishment or any withdrawal of any privileges that is due to him. And sometimes we ask for criteria for withdrawal from the researcher. Like, for example, will there be conditions when the participants can withdraw, or conditions when the researcher will see the adverse events, they will, from their end, not from the participants' end, they will voluntarily discontinue the study for the sake of the participant. Okay, so freedom and voluntariness means that the subject can make the decision without any interference from anybody. So the choice is his and his alone. And it should be from his own free will. Okay. So the consent can be explicit or it can be implied. For those people who are not competent, there are 2 ways we can get a valid consent. One is a substituted judgment. Like, for example, if somebody with a disease where you cannot make a decision, then the one who will make the decision, for example, the legally acceptable or authorized representatives will try to think that if he was competent, will he volunteer? If the answer is yes, then the legally acceptable or authorized representative can sign for the sake of the participant. Or, for example, in some cases, the legally acceptable, the LAR, can think of what is the best for this participant. That's the best interest. And if, for example, children, the young ones, the one who cannot give assent, it's the parent who will give the consent. And the parent usually looks after the best interest of the child and enrolls the child in a study. Now, who will get the informed consent? It should be the physician or the researcher who will do the study. It should not be a nurse na i-delegate lang yun sa nurse yung pag-inform consent. Sige, papirmahin mo na. Or a research assistant who has no idea of the procedure, the risks, benefits, and the details of the protocol. Or just the community leader who says, sige, binovolunteer ko na itong barangay ko na magpa-vaccinate against COVID without any explanation. Basta may vaccine, okay na. 4,000 constituent ko, binovolunteer ko na. Cannot be. Or sasabihin ng barangay leader, ako na ang kukuha ng consent sa kanila, papipirmahin ko lang. Cannot be. Nor is it somebody who has a superiority in terms of position. Or, for example, a doctor, the attending physician will get the consent from his patient. Of course, the patient will have second thoughts and say, I cannot refuse, laking utang na loob ko dito, hindi ako sinisingil nito, so I will say yes to whatever experiment he wants to do with me. Or for example, yung employer, takot yung employee mawala ng trabaho. Okay, kung anong research na in-approve ng employer ko, good as me saying yes also. If there's anything that can be delegated, it's just the formal signing of the paper after the process has been done. Like the explanation, the clarifications, or answering of questions, and being assured that the participant really understood what he was getting into. Okay, so for potential participants who cannot competently give a consent, a proxy or a legally acceptable representative can give the consent. Sometimes in some studies, an impartial witness is required. An impartial witness is somebody who has nothing to do with the research. So it's not a researcher, it's not any assistant, but will try to think in favor of the participant. So dapat mapoproteksyonan ng impartial witness yung participant. Ilalagay niya ang sarili niya doon sa part ng participant, but he has nothing to do with the research team. Okay, the scope is mandatory for every action that will be performed on a person. And then, if the participant is partially competent, may pwedeng mag-intindi, like in children, specific ages, an assent can be obtained besides the consent from the proxy or legally acceptable representative. The one who will take the consent should be able to explain the contents of the form or the procedure, and the position should not be one of authority or superiority, and there should be no external influence, undue influence or coercion in the consent taking. So when do we do the consent? At the recruitment period, and the validity is until the end of the study and even up to the publication of the research. It's continuous depending on the circumstances. When things change, especially if there are severe adverse events, or in socio-behavioral studies, we call the adverse events reportable negative events, the negative things, the unacceptable things that will happen. Then we have to inform the participants and say, these are the things that happen. Will you still be willing to continue? Or after a study, parang bitin, gusto mo meron pang ipagpatuloy pa yon, or a specific aspect of the study will be investigated further, a reconsenting is necessary. Or sometimes, especially in high-risk studies, when you expect so many things happening, it can already be predetermined, and at specific intervals, reconsenting is done, particularly in long-term studies. So when can we not mandate the informed consent process? There are certain exceptions, and the Research Ethics Committee will have to approve the exemption. It's not the researcher who will decide, exempted na yung aking informed consent process. Hindi ko na kailangan ng informed consent form. It's the Research Committee, Ethics Committee, which will decide. And it can be approved in some circumstances, like it's no more than minimal risk, there's anonymity, it's already in the public domain, or the topic is not so sensitive, you don't expect adverse events happening, no adverse consequences to the patient's right and welfare, and there's already authority or community approval, and the study cannot be done without a waiver. If it can be done without a waiver, you cannot exempt the informed consent process. Okay, so then we have the form to prove. Kasi alam nyo naman, mariring magdemanda ang researcher pag may nangyari sa participant. So you should document the process, and there should be a document that proves that the participant really consented voluntarily and willingly. So there should be a signature, a name, a signature, and a date. And the informed consent form should be understood by the one who signed, meaning the participant at his level of education. So for example, kung elementary graduate lang yan, yung language ng informed consent document ninyo, understandable by an element, hindi nyo i-Englishin yun. Lalo na hindi technical language. Kung ang naiintindihan niya lang dialect, it should be translated into the dialect. When you look at the informed consent, usually the proposals are given in English, and then there's a Tagalog translation, or there's a Visayan translation, or whatever dialect the population speaks. So minsan yung translation kakaiba doon sa ibig sabihin sa English. And sometimes the Tagalog terms are the ones which are archaic already and not used commonly. So one good guide there is English to Tagalog. And then yung Tagalog version, i-back translate ninyo sa English. If it's the same, it's a pretty good translation. Pero kung naiba ang ibig sabihin, ay ulitin nyo ang translation. That's a rough guide, other than getting a linguist to or somebody expert in languages to do the translation. It's also a good guide to pilot test it dun sa naintindihan nyo ba? Kung naintindihan nila, then it's good. No overloading of information. Huwag yung, siguraduhin nyo na hindi mahirapang magbasa yung participant na magko-consent. So ang font ninyo kailangan readable, hindi yung font 8, font 9. Kailangan pa ng salamin. Tapos, you will allow the prospective participant to bring it home and say, okay, you can discuss it with your spouse, you can discuss it with your daughter who's educated, or you can discuss it with your community leader, whoever can help him decide. And there should be spaces for signatures and dates. Okay? So the consent document should contain the title, etc. And the statement that it is as a research. Kasi baka akalain ng participant treatment yon. Or that you identify what is your level, na ako po si researcher, etc., no? Tapos ipapaliwanag niya, ganito po ang gagawin sa inyo. Ito ay hindi routine care. Especially ito, pag pananaliksik o pag-aaral, etc. Bakit gagawin yon? Ano ang gagawin doon sa resultang makukuha? Tapos, sino ang gagawa nun? Ano ang mga responsibilidad? Ano ang kailangan mong gawin pag nag-participate ka? Pupunta ka dito sa aming center ng how many times, how many minutes each time. Tapos, kung meron kang katanungan or problema or nararamdaman or whatever, pwede mong tawagan or puntahan kami sa ganito. Okay? And then, na hindi marireveal ang kanyang identity at any point, even until publication. Tapos walang claim doon na sasabihin, oh, this is a safe and effective treatment allowed by the government or regulatory body. Tapos hindi mo masasabi na by signing this document, hindi mo kami ididemanda o kaya wala kaming pananagutan sa inyo. That is unacceptable. No release of liability on the part of the researcher, the sponsor. And to ensure that there is approval by the REC, we look for a statement in the informed consent form that says, if you have any questions regarding your rights as a research participant, you may contact the chairman of the Research Ethics Committee, which approved it, the contact number and the office. Okay? So, yung ibang Research Ethics Committee, pagka nag-approve ng informed consent form, tinatatakan nila bawat page. May date doon ng approval para alam nila na yun ang current approved informed consent form na inapprovean, na yun ang ginagamit ng researcher. So, that's one little tip na kasi hindi lang yun piece of paper eh. Legal document yun eh. Okay. So, what are the contents? The name of the consent giver. Tapos na kompetensya. Tapos sasabihin na binigyan ng pagkakataon magtanong tungkol sa mga nakasaad doon or contents of the consent form. Tapos na binigyan siya ng satisfactory explanations, answers. Tapos binigyan siya ng pagkakataon i-discuss yun sa ibang tao na makakatulong sa kanya para maka-decide na walang nagpupilit sa kanya at naintindihan niya ang contents nun. Okay, and then of course the consent taker and a witness if necessary. So we said before that the consent taker should not be of higher authority, should really take to heart the responsibility because it takes time to explain the contents of an informed consent. Therefore, they should be available and should have the time for it. And the contents of the protocol should be known by the consent taker and ensure appropriate consent giver. So, kung kailangan ng proxy or legally acceptable representative, then those are the people who should sign the consent. Of course, it's better to have a good rapport with the potential participant para mo papayag, hindi ka antipatiko, very, very courteous ka dun sa participant, and wala kang itatago. So there should be truth-telling in informed consent-taking. And you should encourage questions and check understanding with feedback. Hindi mo pwedeng tanungin na, naintindihan mo ba ang in-explain ko sa'yo? Asa, syempre, least resistance, sasabihin ng potential participant, opo. Ano naintindihan mo? Yung content po. It's better to ask them to, can you now tell me what you understood in your own words? Hindi niya ipaparot yung sinabi kasi ibig sabihin nun magaling lang ang memory niya. So, sometimes it's good to have diagrams or pictures in explaining the contents of the form. And of course, don't pressure them na hindi, kailangan pirmahan mo na ngayon kasi wala akong oras. Ito lang ang panahon ko para ibigay sa iyo. So, gusto mo o gusto mo? So, let the participant reflect on it, discuss on it, and finally decide, I don't want to join. Okay? So, respect for the choice of the participant. Okay, kung nag-agree, bibigyan mo siya ng kopya. Kaya kung ano man ang kulang doon, kakulangan doon, or hindi mo in-explain, pag nagkaroon ng problema, of course, the court will always favor the victim. So, it's safe to do a proper consent process. At the end of the day, after na nag-agree yung participant, you have, of course, to show your appreciation. Thank you po. Okay? And dapat meron ngang avenues for queries, complaints, and feedback. And when new findings come in, then a reconsent is necessary. Lalo na pagka i-impact yun sa decision to continue or not to continue participation. Pero pagka umayaw na, hanggang doon ka na lang. Monitor dissent on the part of the participant, lalo na sa children. So in the children's assent, the National Ethics Guidelines give specific ages. So an assent is a child's affirmative agreement to participate in addition to the parents' consent or permission. If less than 7, hindi na formal assent. Yun na lang parents or LAR ang pwedeng mag-sign. Pero less than 7, pag ayaw ng bata, halimbawa, lalo na pag may injection, ganon, or any therapeutic intervention, pag naglupas yan at ayaw, hindi pipilitin. Okay, less than 7. 7 and less than 12 years old, oo, hindi, verbal assent. Pero i-explain din sa bata. At i-document yun na nag-verbal assent yung bata besides the LAR. And for 12 and up to less than 15 years old, a simplified form can be signed and by the child, and the parent will have a separate informed consent form For 15 to less than 18 years old, one form na lang, signed by both the child and the LAR. Okay? This dissent should always be respected at any one point. Okay. Sometimes we need the permission or the consent of both parents. You only need one parent if the study will involve minimal risk, but you need two parents to sign if more than minimal risk, or if there's a chance that the parents will disagree on the decision, or if there's no direct benefit to the child to participate. The best interest of the child should take priority over autonomy, especially in therapeutic trials. So the REC determines the child's capability, works for the best interest of the child, and tries to determine whether a waiver of consent is necessary or not. Okay? So parents' permission does not necessarily mean that the child agrees. It can be subject to abuse. And there are some children who are, we call the emancipated children, wherein they're no longer under the control of the parent. For example, yung mga less than 18, tapos nag-asawa na, hindi na siya under the control of the parent. A child is not capable of fully understanding the informed consent. And that's why we need a legally acceptable representative or a proxy consent. But still, the child should be informed about what is to be done to him or her. Okay, and it should be documented. In summary, free and informed consent shows respect to the autonomy of the person, and it gives justice to the participant. It protects the participant's right to decide what should be done to him or her. And it's not a one-time signing or thumb marking, but a continuous process. And it should be obtained with respect and honesty. Therefore, truth telling, you don't hide anything. And there should be concern for the best interest of the participant. And it's a science as well as an art, and always involves trust and confidence between the parties involved. Thank you. So do you have any questions? Any questions? Walang question?